Thank you for your attendance here and now for the Stroger Hospital and Cook County Health and Hospital System Training Module Number 14, Operating Room Between Procedure Cleaning. As an important member of the Stroger Environmental Services team, we welcome you to this training session, and we hope that you find it helpful and informative. Let's begin.
We will start by defining between procedure cleaning of the operating room. Then we will distinguish it from terminal cleaning of the operating room. It is important for you to know the difference between the two. Between procedure cleaning is the cleaning work performed by the ESV worker immediately after one patient operation has been completed, for purposes of preparing the room for the next operation to begin. This is distinguished from the terminal cleaning of the operating room, which is performed at the end of the day after all patient operations have been completed, and it is the final, top-to-bottom, thorough cleaning of the OR. Knowing this difference, it should make sense to you that in performing between procedure cleaning, you are working under the following challenging conditions. First, you have limited time to complete your cleaning of the OR. Because the Stroger medical staff has many operations to complete in the course of the day, downtime of the OR for cleaning must be minimized. Second, you must conduct your work very efficiently. Third, and finally, you will clean fewer surfaces overall than in a terminal cleaning, while still making sure to cover all must-clean surfaces, such as the operating table, the surgical lights, and the surgical trays. Also, while terminal cleaning of the OR is generally performed only once per day, the frequency between procedure cleanings will be multiple times during your work shift. Because of this, planning and organizing your work is critical. You need to check the schedule of patient operations and plan your work shift knowing how many OR cleanings you will be performing and approximately when you will be doing them. Also, once your plan is made, you need to be flexible and ready to modify your plan as your shift progresses. Some operations will take longer than expected. Others will be shorter. As these scheduling changes occur, be ready to respond to calls and requests that will come to you from the Stroger medical teams when they need you to perform your cleanings and prep the room for the next operation. Remember, our goal is to provide infection control through good disinfection cleaning, thereby minimizing the risk of dangerous microorganisms and cross-contamination from one patient to another.
A summary of the topics we will be covering in this training module will include the following. Number 1, the stainless steel cart used for cleaning the OR. Number 2, preparing yourself and your equipment before entering the OR. Number 3, pre-inspection of the OR and the importance of planning for efficient workflow. Number 4, emptying waste receptacles. Number 5, collecting soiled linens. Number 6, cleaning the OR sink and surrounding areas. 7, cleaning the operating room table. Number 8, cleaning the trays, stools, and other high hand-touch surfaces. Number 9, damp mopping the floor. Number 10, final inspection before exiting the OR. And number 11, removal and disposal of PPE and hand hygiene upon completion of your work in the OR. If you're ready, let's get started.
Notice that we do not use the same service cart for cleaning the OR as we do for cleaning the patient rooms of Stroger Hospital. For the OR, we use a service cart constructed almost entirely of stainless steel. Note that the bucket mop and wringer set are also stainless steel. Stainless steel provides the necessary higher level of sanitary infection control and minimizes microorganism cross-contamination. As such, it is vitally important that you always use a stainless steel cart designed for use in OR. Never use a standard patient room service cart for your work in the operating rooms. Equally important is making sure that your cart is clean, sanitized, and spotless. Prepare your cart with the tools, supplies, and equipment you will need, and also make sure that you inspect your cart and that you clean it thoroughly before using it for your work. Finally, remember to include CaviWipes 1 and Cavicide 1 disinfectant cleaner on your cart. This is powerful and fast-acting disinfectant required for use in Stroger Hospital's operating rooms.
Once your cart is prepared, it's now time to prepare yourself with hand hygiene and PPE for work in the OR. Make sure that you have the correct PPE clothing. This includes a Stroger Hospital Scrubs uniform, freshly cleaned. Also, you should have a head covering, and if you have facial hair, such as a beard or mustache, you must wear a face hair cover. You will also need to wear protective latex gloves. Before putting them on, you must perform a thorough hand washing. For complete instructions on the proper way to wash your hands, please review Stroger Hospital's training module number 3 entitled Hand Washing and Hand Hygiene.
Your cart is clean and prepared. Your hand hygiene is completed and your PPE in place. You are now ready to enter the OR. Leave your cart and all of your tools outside of the OR. Never bring your cart into the OR. As you perform your work, you are allowed to bring in only the tools and materials necessary for the performance of a particular task at hand. Never bring in several different sets of tools and materials for the performance of a series of cleaning tasks. When you finish the task, go back into the hallway, return the tool and materials you have just used, then obtain the item or items you will need to perform your next task. Your first task upon initially entering the OR will be to conduct a pre-inspection of the room. For this task, you may wish to bring in a clipboard or checklist. While conducting your pre-inspection, be mindful of carefully planning your work. You will need to cover the must-clean surfaces, but you will also need to clean any visible spills, smudges, or splashes of dirt. Examples might include blood or bodily fluid spills on floors or other surfaces, fingerprints or smudges on high hand touch areas, soiling on areas not usually cleaned in between procedure cleanings that will require cleaning and disinfection. For example, a spill or splash on the wall. You will also want to note any items requiring repair or maintenance and that require reporting to the Stroger Buildings and Grounds Department. Also, as part of your pre-inspection, be mindful to look for unsafe conditions in the OR, especially with regards to sharps improperly disposed of or left out on trays, tables, and floors in waste receptacles. If you find any sharps, do not touch them. Instead, report the situation immediately so that this unsafe condition can be corrected.
After completing your pre-inspection, your next task should be to empty all of the waste receptacles in the OR. Remember that in your pre-inspection, you looked into the waste receptacle to see if any sharps were improperly placed inside. This initial inspection, however, only allowed you to observe what is lying on the very top of the waste within any receptacle. Buried below could be improperly disposed of sharps that you can't see. Because of this, you must follow all of the required procedures to safely remove waste from each OR receptacle. For a detailed description of safe trash removal, please review the Stroger Training Module number 2 on safety and safe work practices, especially the section on safe trash handling. Finally, as part of gathering trash from the OR, remember that you will be handling 3 separate trash types that must all be kept separate. Regular trash, collected in clear trash liners. Biomedical trash, collected in the specifically marked red trash liners with the biohazard label. Sharps containers, collected in wall-mounted, sealed boxes, specially designed for the safe disposal of needles and other disposable sharps. Never mix these separate types of waste. Also, when handling a full bag of standard trash or biohazard trash, always hold the liner from the top of the bag. Never attempt to compress the trash. Never lift a full trash bag from the sides or bottom. Hold the bag away from your body and do not let it bump up against your legs or any other part of your body. This is to avoid a needle poke injury that can occur if a needle is buried deep inside of the bag. Finally, if you need to remove a full Sharps container, remove the entire Sharps box. Never attempt to open the Sharps container. Never try to empty the Sharps container by removing the contents within. Sharps containers are designed to be disposed of whole and replaced by a brand new, empty and unused Sharps box.
Your next task, after the removal of trash, is to collect all of the soiled linens in the OR. You will find most soiled linens on or near the operating table. However, carefully look around the room in case any soiled linens have been left on trays, counters, or tables, or have possibly fallen on the floor. Carefully examine the linens, looking inside of the folds to be sure that no Sharps have been accidentally left behind. Next, strip the linens from the operating table bed and carefully place them in the blue bag container for the collection of soiled linens. Other linens that may be found elsewhere in the OR should also be placed in the blue bag container.
Now that you have collected all of the trash and all of the soiled linens, it's time for you to begin actual cleaning and disinfection work. Start this work at the OR hand scrubbing sink and the area adjacent to the sink. As with all cleaning and disinfection work, start high and work your way down. In this manner, any dirt or dust dislodged or any splashes or drips that fall down will be cleaned as you work from top to bottom. Wipe all surfaces above the sink with a heavy coating of Cavicide 1 disinfectant cleaner and allow for the full 60-second wet dwell time for the solution to kill microorganisms. Clean the walls, mirrors, soap dispensers, and other surfaces above and around the sink area. Next, clean the faucets, the sink backsplash, and the large square bowl basin of the sink. Follow through by cleaning and disinfecting the front, side, and lower exterior surfaces of the sink, including any exposed plumbing pipes under the sink. All surfaces must be cleaned with the Cavicide 1 or Cavicide Wipes 1 disinfectant, and all must be given the full 60-second wet dwell time for disinfection. After completion of cleaning the OR sink, perform hand hygiene before starting your cleaning work in the other areas of the OR.
Cleaning the operating table. Because most of the activity of the OR is conducted on the operating table, this piece of equipment must receive special and focused attention in your cleaning and disinfection work. All surfaces of the operating table must be disinfected using Cavicide 1 or CaviWipes 1. Also, the protocol for working from top to bottom must be strictly followed. Removal of all soiled linens from the operating table should have been fully completed in the earlier steps of your work in the OR. If any linens remain, remove them now. Start by cleaning and disinfecting the surgical lights first. These are the large, round light fixtures that hover over the operating table. Clean and disinfect all surfaces of the surgical lights, including the back sides of the lights, the light lenses, and the arm frames that support the lights. Look for the high hand touch areas of these lights. These are the handles that the medical teams use to pull the lights into the best position for shining light on the medical procedure. After all lights and other equipment above the operating table have been cleaned, it is time to clean the operating table pads and the upper stainless steel surfaces that support the pads. Clean both sides and all edges of the large flat pads. Clean the stainless steel tabletop that the pads rest on. Clean the table arm supports and restraining straps. Clean the side rails of the table. And upon completion of the pads and the upper stainless steel surfaces of the table, clean the lower level surfaces, including the table pedestal and base. As with all other cleaning in the OR, pay special attention to allowing a full 60-second wet dwell time for full microorganism kill on all surfaces of the operating table.
Upon completion of cleaning the operating table, it is time to clean the mid-level and low-level surfaces with an emphasis on cleaning high hand-touch areas. As you perform this work, you must continue to keep in mind the practice of cleaning top to bottom and high to low. In planning your work, take a moment to look around the OR and identify in your mind the high hand-touch areas. These are areas that receive a lot of hand traffic by the medical staff who work in the OR. They include doorknobs, light switch plates, surgical light adjustment handles and pull spots, tray tables, counters, and cabinet pull knobs. This emphasis on cleaning high hand-touch areas does not mean that you skimp on cleaning all of the other areas of the OR. All surfaces must be cleaned and disinfected. Instead, focusing attention on the high hand-touch areas helps to make sure that visible fingerprints, smudges, or smears of blood or bodily fluids are fully eliminated from these surfaces. As you clean and disinfect all equipment, such as stainless steel trays and stools, work from top to bottom, finishing up by cleaning the lower legs or pedestals of these items.
Use your flat microfiber mop head and pad and perform damp mopping of the entire OR floor. Work in a clockwise pattern through the OR and use an S-shaped stroke with your damp mop. Be sure to mop the corners and edges of the OR very well. Do not leave accumulated dirt or debris in the corners or along edges. Move light furniture and objects and mop the floor underneath. For heavier fixtures and objects, be sure to damp mop underneath as far as you can reach. Upon completion of damp mopping, you are almost finished with your duties for cleaning the OR. As part of wrapping up, make a final inspection of the entire room to make sure any last details have not been missed. As part of this final inspection, be sure to check the following. Make sure there are no visible signs of dirt, debris, fingerprints, spots, or spills that have been left uncleaned. Note any items that need repair and maintenance. If there are any, make a note to report this to the Buildings and Grounds Department of Stroger Hospital. Look around to make sure you haven't missed emptying any waste receptacles or left behind any soiled linens. Look also to make sure you have picked up all of your tools, equipment, and supplies, and that you are not leaving anything behind.
Upon exiting the OR, remove and properly dispose of your PPE, including your protective gloves. Wash your hands thoroughly in accordance with the Stroger Hospital's Training Module Number 3, Hand Washing and Hand Hygiene. If you are unfamiliar with this module on hand washing, make arrangements with your supervisor to review the module before doing any work in the OR.
Thank you for participating in Stroger Hospital Training Module Number 14, Between Procedure Cleaning of the Operating Room. We hope that you have found this training session useful and informative. As always, if you have any questions on this module or any other of your duties and responsibilities as an ESV worker, please inquire with your supervisor.